than listening to other versions of what's going on. You know, the Affordable Care Act, I want to talk about what it means for people here in the Commonwealth of Massachusetts. We've already taken step one, obviously, coverage. And we're now struggling hard on step two, which is cost. Because it's not enough to get everyone covered if, in fact, there is still so much cost borne by individual families in co-pays and other parts to the healthcare system, so much cost for small businesses that they have trouble staying in business and making their healthcare premiums, so much cost put on large businesses that they can't expand. So one of the key things we've got to do is cost. The Affordable Care Act is our first real effort from the federal government to try to bring costs under control. There's no magic bullet in it. It makes it hard to talk about, but it's got lots of pieces in it. For example, to fund the research on how to bring down the cost of treating asthma by getting better outcomes for the kids early on, so fewer of them have to go to the hospital. It's about how to get better treatments for diabetes, so that people have better health outcomes, so we're not spending as much money on health care down the line. So I always say about Affordable Care Act, keep in mind, when the Republicans talk about repealing the Affordable Care Act, and do keep in mind my Republican opponent ran on voting against the Affordable Care Act, ran on, and then went in and voted against the Affordable Care Act, and now is running again on, if he gets the opportunity, he will help repeal the Affordable Care Act. That if that happens, you'll like this, our national deficit, the budget scoring, goes back up. We lose money if we lose the Affordable Care Act. So it's a pocketbook issue for everyone. The second part I want to say about it, so people are talking about it, we now have kids all across this Commonwealth, and now about 2.5 million across the country, who are covered on their parents' health insurance policies as a result of the Affordable Care Act. Indeed, one of the people taking advantage of that, his name's Scott Brown, which I think that's great. He should take advantage of it. He should just not be working to repeal it so that no one else can take advantage of it.